Ever catch yourself, like, clenching your jaw during, I don't know, a tense moment?
Oh, absolutely.
Like that meeting where you could have sworn you heard your molars creak?
I've been there.
Turns out that's not just, a weird party trick. It's called awake bruxism.
Yeah.
And based on what you've sent, seems like you're ready to, get a grip on this whole teeth gritting situation, right?
Definitely.
So we're diving deep into your sources on awake bruxism,
Love it.
what it is, why it matters, and, what you can actually do about it.
And what's fascinating is we're not talking about a small handful of people here.
Right.
This is a significant portion of adults' experience awakened bruxism.
It really is. The fact that a third of adults are walking around, potentially, clenching their way through the day, kind of blew my mind.
Right.
So before we go any further, let's define what we're talking about. Awake bruxism is basically the grinding, gnashing, clenching of your teeth.
Yeah.
But here's the catch. It happens while you're awake.
Awake, exactly.
This is different from that nighttime teeth grinding your partner might complain about, sleep bruxism. While both involve that same jaw action, they're considered like different beasts altogether.
Totally.
Today, the spotlight is on what happens when those peepers are wide open.
And that's where it gets really interesting because a lot of people, they might not even realize they're clenching or grinding their teeth until, those subtle symptoms start to show up.
Totally. The sources you sent mentioned some sneaky side effects. Like, I bet a lot of people wouldn't even connect them to teeth grinding.
Like what?
Like earaches,
Ah.
jaw pain, headaches, sure. But earaches, who knew?
Yeah.
It's like, what's the connection there?
Well, it's all connected, right? Those muscles, the nerves in your head, your neck, they're all kind of intertwined. So when those jaw muscles are constantly engaged in that clenching, that tension can actually radiate pain outward. So that earache you're feeling could be a consequence of what's happening in your jaw.
Wow. That's wild.
It's all connected.
And to think I'm someone who pops an ibuprofen at the first sign of a tension headache.
Yeah.
Completely oblivious to the possibility that could be my jaw, like sending out an SOS signal.
Right. Exactly.
This is already eye-opening. Okay. Before we get ahead of ourselves, let's address the elephant in the room, or should I say the tension in the jaw. I don't know about you, but I've definitely brushed off that occasional jaw clenching, like it's no big deal.
Yeah.
Oh, it's just stress. Everyone does it.
Sure.
But knowing what we know now about those sneaky side effects, is this something we should actually be concerned about?
Yeah, it's a good question. And it's one I hear often. And the truth is the severity of your awake bruxism really plays a significant role here.
Okay.
Occasional clenching here and there, probably okay.
Right.
But when it becomes a frequent visitor in your daily life, that's when we need to start paying attention.
So let's say, hypothetically, that frequent clenching goes unchecked. What's the worst that could happen? What are the risks?
So the potential consequences are definitely worth taking seriously. Every time you clench or you grind your teeth, you're essentially putting those pearly whites through, a mini wear and tear session. And over time, this constant friction can actually wear down the protective enamel on your teeth, and that makes them vulnerable to fractures, chips, even loosening.
And it doesn't stop there.
It doesn't stop there. Your jaw muscles, they're working overtime in that clenched state, and they can become, unhappy, leading to, chronic jaw pain, difficulty chewing, and even a condition called TMJ disorder.
TMJ.
That sounds intense. What is that exactly?
So TMJ disorder, or temporomandibular joint disorder, affects that hinge joint that connects your jaw to your skull.
Okay.
Right in front of your ears. It's responsible for all those smooth movements, we take for granted, talking, chewing, yawning.
Yeah.
But when this joint is affected, often due to this chronic clenching and grinding,
it can create a cascade of problems. Pain, clicking or popping sounds in the jaw, even difficulty opening and closing your mouth.
Okay, now that's something you definitely don't want to just ignore. This goes way beyond just, aesthetics or a little discomfort. We're talking like potential long-term impacts on your health and well-being.
Precisely. And it can become this vicious cycle. You experience pain, discomfort from the bruxism. That can lead to increased stress, anxiety, which, as we know, can further fuel those teeth-grinding tendencies.
It's like this runaway train of tension.
Yes.
With our jaw just stuck on the tracks.
Exactly.
Okay, so we've established awake bruxism is a real problem. Potential for serious consequences if left untreated. But this begs the question, Why are we doing this to ourselves?
Right.
It's like our brain is sending our jaw on a kamikaze mission.
Yeah, if only our teeth could talk. Right.
Right.
They'd probably have some wild tales to tell.
Oh, I bet.
But, in all seriousness, there's no single answer when it comes to what causes awake bruxism.
Oh,
It's like this complex puzzle with multiple pieces, and they're all contributing to this bigger picture.
so let's break down these puzzle pieces, shall we?
Let's do it.
What's, like, number one?
Let's start with the usual suspect, stress.
Okay.
Often considered a primary trigger for awake bruxism. Especially, come on, in our always-on, fast-paced world,
Makes sense.
deadlines looming, traffic jams testing our patient,
To-do list.
that never-ending to-do list.
Yeah.
Our poor jaws bear the brunt of it all.
It's like they become the silent warriors, right?
Yeah.
Absorbing all the tension and pressure.
Exactly.
Okay.
Yeah.
So, stress. What else?
So age, believe it or not, is another factor.
Really?
Awake bruxism is surprisingly common in children, especially during those teething years.
So it's not just a phase. Like, we grow out of it.
Unfortunately, no, it can follow us into adulthood. And you know how we're talking about stress?
Yeah.
Well, our personality and how we handle that stress, that comes into play too.
Okay.
People who are naturally more prone to stress, anxiety, or tend to be more competitive, type A maybe,
Right.
they might find themselves clenching, grinding more often. It's like their body's way of trying to release that pent-up energy, tension. And the jaw just becomes the unfortunate outlet.
That's so interesting. So it's not just, like, external factors,
Yeah.
like a stressful work environment, but also, like, our internal wiring.
It's how we're wired.
Yeah, that can contribute. Some of us are just wired to clench
Yeah.
in response to, life's challenges.
Exactly.
But stress and personality aside, what about other potential culprits?
Yeah.
I'm curious about those sneaky side effects you mentioned earlier,
Yeah.
like the earaches. Are there other surprising triggers?
You're right. There are other factors. Remember how we were talking about how interconnected everything is
Mm-hmm.
in our head, our neck?
Right.
Well, it turns out that misalignment in your bite, even subtle ones,
Really?
can throw off the harmony
Wow.
of those jaw muscles and contribute to bruxism. It's like wearing a pair of shoes that are just slightly too small.
Oh, okay.
You might not even realize it at first, but it can definitely impact how you move, how you feel.
Right. It's not always just a psychological response.
Right.
Sometimes it's physical as well.
Absolutely. And to complicate matters further, some medications and substances can actually increase the likelihood of bruxism.
Wait, really?
Yeah.
Like what? Give me some examples.
Well, for starters, that afternoon cup of coffee,
Oh, no.
as innocent as it may seem, could be contributing to your teeth-grinding woes.
No way.
Caffeine, it boosts our energy, our alertness, but it can also amp up muscle tension, including those in your jaw.
Wow. I never would have guessed that my caffeine fix could be, like, a culprit.
Yeah. And let's not forget alcohol.
Oh, yeah.
A glass of wine might seem like a relaxing way to unwind, but it can disrupt your sleep cycle and increase the likelihood of clenching or grinding at night.
Now that you mention it, I've definitely caught myself clenching while trying to fall asleep after, one too many glasses of wine.
Uh-huh.
But I always just assumed it was the stress of the day.
Uh-huh.
Maybe it was the alcohol.
Could be. And then, of course, there's the genetic component.
Oh, right. Genetics. I almost forgot we were talking about that.
Yeah.
So if bruxism runs in my family, am I destined to just clench my way through life?
Not necessarily. While research suggests that genetics might play a role, it doesn't mean you're automatically doomed if your parents or siblings are, avid teeth grinders. Think of it this way. You might inherit a predisposition, but environmental factors, like we've been talking about, can significantly influence whether or not that predisposition actually becomes a full-blown clenching habit.
Okay, so it's not a guaranteed inheritance like those pesky freckles I got from my parents.
Exactly. And another fascinating aspect of awake bruxism is that it can sometimes be a learned coping mechanism.
A coping mechanism. What do you mean by that?
Think about it. When we're laser focused on a task, whether it's studying for an exam, giving a presentation at work, even engaging in intense physical activity, we often unconsciously clench our jaw
Interesting.
as a way to channel that energy and concentration.
You're right. I've caught myself doing that, clenching my jaw during, like, really intense work sessions.
Right.
It's almost like it helps me focus, push through.
Exactly. And while it might seem harmless in the moment, over time, that unconscious habit, it can turn into a chronic issue.
So we've got stress, Age, personality,
Hmm.
those sneaky substances,
Yeah.
caffeine, alcohol, potential bite misalignments,
Mm.
genetics,
It's a lot.
learned coping mechanisms, all playing a role in this intricate dance of awake bruxism.
It's complex.
This is a lot.
Yeah.
So there's no one-size-fits-all answer. This is definitely a, like, talk to your dentist kind of a situation, right?
Absolutely. But while we may not have all the answers right here, right now, the good news is there are things that you can do to potentially stop this teeth grinding train in its tracks.
Okay, that's a relief. I was starting to get a little worried there. So
Hmm.
now that we understand why we grind, let's explore what we can do to, stop it.
Let's do it.
What are our options? Asking for a friend, of course, who may or may not be clenching their jaw as we speak. So let's talk solutions.
Right.
What can someone do about this? What are, like, the go-to treatment options?
Well, the good news is there are several approaches to explore. But before we dive in, quick disclaimer,
Right.
we're your guides to the information you provided,
Of course.
not medical professionals.
We are not.
So consider this your cue to have a chat with your dentist for personalized advice.
Exactly. We're all about empowering you with knowledge, not giving medical advice. So with that said, what are some avenues that, people could discuss with their dentist?
One of the first lines of defense is often a mouth guard.
Okay.
It acts as like a protective barrier for your teeth, preventing that grinding and clenching from, wreaking havoc.
Mouth guards make sense, but I've heard there are different types.
You're right. You've got custom-made ones molded by your dentist, so it's a perfect fit, but pricier.
Right.
And then there are over-the-counter varieties, which are obviously more budget-friendly, but might not be as comfortable or as effective. So, it really depends.
So, like, gotta find the right fit.
Exactly.
Okay. What about other options? What if someone wants to, like, address those overactive muscles directly?
That's where Botox comes in,
Oh, really?
which might seem surprising.
A little bit.
But remember how we were talking about those overworked jaw muscles?
Hmm.
Botox can temporarily relax them, reduce the intensity of the clenching, the grinding, kind of like hitting the pause button on those overworked muscles,
Wow.
giving them a chance to chill out.
Okay. So it's directly targeting the muscles, not just protecting the teeth. But is it a permanent fix?
That's an important point. It's not a permanent solution. Multiple treatments are usually needed, and more research is still being done on its long-term effectiveness.
Got it. Not a one-and-done kind of deal. What about those, like, high-tech solutions I've been hearing about? Anything out there that's, like, brain training but for your jaw?
You're thinking of biofeedback.
Okay.
It's this fascinating approach that involves retraining your brain to become more aware of those unconscious clenching and grinding habits.
Uh-huh.
So you learn to control those muscles, break the cycle of tension and pain.
Wow. That's wild. So we've got options to protect the teeth, relax the muscles, retrain the brain.
Right.
How do you know which one to choose?
That's where that chat with your dentist is crucial.
Right.
They can assess the severity of your bruxism, pinpoint those underlying causes, and recommend the best course of action. Because ultimately, the most effective treatment will address the root of the problem.
Right.
If stress is the primary culprit, well, then stress management techniques are going to be key.
Okay.
But if it's a misaligned bite, well, that needs attention too.
It's like a puzzle.
Exactly.
You need all the pieces. Now, before we wrap up, our sources mentioned something about kids and bruxism.
Oh, yeah.
Any advice for parents?
It's actually very common for kids to grind their teeth,
Okay.
especially during those teething years. And while most grow out of it, it's still a good idea to have their dentist monitor it, especially if it's causing, discomfort or noticeable wear and tear.
So parents, keep an ear out for those suspicious grinding sounds. And with that, we've reached the end of our deep dive. It's amazing how such a, seemingly simple act like clenching your teeth can have such far-reaching implications.
It really is. It just highlights how interconnected our bodies are and how those subtle habits can really impact our overall well-being.
Speaking of interconnectedness, one final thought to leave you with. Our sources hinted at a connection between posture and bruxism.
Interesting.
Apparently, how we hold ourselves throughout the day can actually contribute to jaw tension and teeth grinding.
Who knew?
So maybe that's the motivation we all need to finally perfect that, ergonomic workstation setup. Until next time, stay curious and remember, knowledge is power when it comes to taking charge of your health.